Faith Jordan, student ID is 3630837, and today I will be demonstrating how to perform a Schirmer tear test for veterinary nursing care fall semester 2024. So I've got my patient here, I have got my Schirmer tear test strip, and what we're going to do is we're going to take the strip out, but before we take it out, we're going to bend it right before. There's a little line marked here, and that's where we're going to bend it. Okay. And then taking this strip, I'm going to hold open the lower eyelid here. Stop smelling. I'm going to place it in, and you want to hold it outer and just gently hold the eye shut. I will start my timer for 60 seconds. If you force the eyelid shut too hard, you will get inaccurate results because that pressure will make more tear production. Same thing with if it's placed towards the medial canthus, you'll get false results as well. So once this timer goes off in 60 seconds, we will have our reading. Okay, so I've just removed the strip after 60 seconds. If we are below 5 millimeters per minute, that is going to show that we have got a significant decrease in tear production. If we are between 5 and 10 millimeters per minute, that is going to show just a decreased tear production. And then between 15 to 20 greater than, we're gonna be in a normal range of tear production. So he is at 16, we're in a normal range of tear production. My name is Faith Jordan, student ID is 3630837, and today I will be demonstrating how to do a fluorescein tear stain for veterinary nursing care fall semester 2024. What you'll need is a pair of gloves. You will need your fluorescein sodium ophthalmic strip, some gauze, and then eye wash and your ophthalmoscope. So some doctors will order a drop of proparacaine onto the eyes to numb them because it can be uncomfortable. Other doctors don't require that or request that. There's a couple different ways you can stain the eye. You can apply a drop of the eye wash to the strip itself and then dot the strip to the conjunctiva, or mix the strip with a solution to get it into a syringe and drop that into the eye. Okay, so for the purpose of today, I am going to apply a drop of my eye solution to the stain strip and touch that to his conjunctiva. Come here, Miller. Come here. And sit. Good boy. Buddy, it's okay. Okay. Now you'll need your stack of gauze here to hold that under the eye while I take our eye rinse. I know, we're gonna rinse it and flush that stain out. I know it feels weird. Okay, there we go. Okay. Now we're going to go to a dark spot, which would typically be like a dark exam room, shutting off the lights, or just somewhere where it's nice and quiet, and using a lamp, using a normal pen light, or you can use your ophthalmoscope with the black light setting to look for any uptake. So that stain will take uptake on layers 1 through 9. Typically, you're looking for an ulcer of some sorts and prescribing eye medication to know what's safe and what's not. If you do have an ulcer, steroid medications would not be indicated in use because that can cause scarring and blindness. Okay, so I've got my black light here with my ophthalmoscope, and we're gonna be looking anywhere on the eye for any of that fluorescein stain to uptake. It'll be bright yellow in color. And so far, I'm not seeing any uptake upper or lower or inner corner there, so towards the medial or lateral canthus. I don't see any stain uptake, so for eye infection purposes, it would be safe to prescribe him something with a steroid. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating a tonometry test for veterinary nursing care fall semester 2024. So a tonometry test is to measure the intraocular pressure of the eyes. I've got my Tono pen here. Based off the user's manual, it says not to use proparacaine for the most accurate results, and these have their own probes. So instead of a probe cover, this gets changed out every time. So I'm going to turn the pen on, and it's going to indicate to me that I need to load it. So what I will do is take this off and tip that into there. Okay, so now I'm gonna take 6 readings with this. So it's gonna be held at a 90-degree angle, about 4 to 8 millimeters away from the cornea. And within 6 readings, it'll give me that overall mean of what the intraocular pressure should be. So. Okay, so the results I have once it stopped me at 6 is 14. Normal values are going to be 12 to 25 millimeters per mercury. So typically we do this test in patients that have kidney disease or glaucoma, because of that eye pressure can indicate some secondary conditions that might require additional procedures. But after the 6 readings, like I said, it gives me that mean value. His was 14, so he's within that normal range. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating and performing how to do a enema and all the things that are needed for that, what the indication is for veterinary nursing care fall semester 2024. So I've got all my things here. Right now I'm actually preparing to do an enema on a 4-month-old kitten who presented for lethargy, not eating, and vomiting blood. So doctor ordered radiographs, and upon looking at those, we're very constipated. So it's surprising how much stool is in this 4-month-old kitten. So the things that you're gonna need are some gloves, because that can get messy. Anywhere between a 20 and 60 cc syringe is fine. Because we're so little as a kitten, we're gonna start with 30 mLs and see how much that is. I don't anticipate needing a 60. However, if I can't get this onto my red rubber when I go to insert that and give the enema, this slip tip might be better for that. So I do have that as well, just in case. I've got some lubricant jelly here to lube the red rubber catheter before I insert that into the rectum. And then I've also got Dawn dish soap. So what I'm gonna do is some clinics will, or doctors will order lubricant to be mixed in some room temperature water or mineral oil or Dawn dish soap.
Somebody is available. Can I please have somebody check on Wally?
Or like a chlorhexidine soap solution, very diluted, but to help loosen everything up. And so I'm gonna get started in prepping that. Okay, so I'm gonna start by getting my room temp water. And I will check this with a thermometer to make sure it's room temp. We do not wanna scald any parts of the colon when we do this. And I'm gonna do a decent amount, because even though we're gonna start with 30 cc's, doctor might want us to end up doing more, and it's better to be over prepared. So now I've got my Dawn dish soap, and I'm gonna make that diluted solution. I'm gonna do 2 pumps. Okay. Now I'm gonna take my syringe here and I'm gonna use that to stir it up. Now, when I look at this, not in the bowl, because sometimes the bowl can contraindicate, not contraindicate, but can skew the coloring of the solution. When I'm doing it, I want like a very light blue. Like if you were to find a light blue Gatorade at the store, that's the color you want this to be. So that looks good. I'm gonna leave that there. Now I'm going to take my red rubber. So I did pull a 6 French and an 8. However, with the 6, this is such a small opening at the end here to push fluids through. And especially with the amount of stool that I know we're gonna be dealing with, might be a little hard. So I do have an 8. I do anticipate this fitting just fine. So I'm going to open this up. And this is not a sterile procedure, however, it's messy and smelly, so you do want to be as clean as possible. I'm going to take this, and I want to prime this so I'm not pushing air into the colon further. And just like I suspected, that does not fit. So I'm going to take my 60 cc here. Which is a slip tip. I'm going to pull up about 20 cc's, insert, and it's coming out. So now I will get this on my wet table and set up for the cat and come back and show you the enema portion. Okay, so I have my patient here. He's pretty dumpy as it is, so we may or may not need sedation. I do have 3 mLs of propofol drawn up though to titrate if he won't tolerate it. You want them to be relaxed, right? Because we're trying to move all of that hard stool out, and if they're tense and they're not really letting you do the procedure, it's gonna be a lot harder. So what I'm gonna do is I will hook him up to my monitoring equipment, titrate just a little bit of propofol. He's more alert now that I've moved him. And then once I insert that red rubber, I will administer 30 cc's, that's what the doctor has ordered, of the enema solution. I'll massage his belly a little bit, depending. I might stimulate around his anus a little bit with either my finger or try and insert. We're not necessarily deobstipating because that's a lot for a tiny guy like this. And then we'll wait about an hour to see if he has a bowel movement. If he does, we'll recheck a lateral x-ray. If he does not, we will repeat. Okay, so now that he is slightly sedated, I've got him hooked up to his leads. I'm going to take my syringe here with my red rubber. And doctor has ordered 30 mils. So I have got 30 mils here. I've got my sterile lube that I've already opened, but I'm going to just place a little bit to get the end here nice and lubricated. And I will lift his tail, and oh, we have fleas, and I'm going to insert that up until I can't anymore. Now he is really full of stool, so sometimes it does take some maneuvering. And once I don't feel like it's twisted and it's in all the way, I will slowly administer the enema solution. And once I get close to the end, I'll still continue to administer it as I pull it out. My name is Faith Jordan. Student ID is 3630837. And today I will be demonstrating how to do a nail trim on a dog for veterinary nursing care fall semester 2024. So this is my friend Arrow. Arrow came in for dog fight wounds. He is sedated right now, but we are currently alive, and he's actually recovering from sedation. So things that you'll need for your nail trim is your antiseptic stop powder, so quick stop, your nail clippers, and then your gauze that's going to keep your quick stop on it, because you do not want to dip the nail should you accidentally clip the quick directly into the quick stop. So what I'm going to do, it's best if they're in lateral or standing, but because he's got dark nails, you're gonna wanna cut only a little bit at a time. So at a 45-degree angle, and you're just gonna cut back little bits until we see that quick exposed. So now that I see that little black center there, that is when I'm going to stop. I'll go on to the next one. And with these thicker nails, sometimes it's easiest if you take a little bit off at the sides and cut them back. And there's the quick again, so that tells me to stop. And there I'm gonna stop. And that is how you do a nail trim on a dog. Hi, my name is Faith Jordan. Student ID is 3630837. And today I will be demonstrating how to do a nail trim on our feline friends here. Things that you will need are your cat nail clippers, some gauze squares, and some antiseptic stopping powder, quick stop. I like to put this on a gauze square instead of dipping the nail directly into it and then contaminating the rest of it with their blood. So this is my friend that I just got done doing an enema on. He is recovering from sedation. And just to show you, he is starting to wake up. He does have a blink reflex. Our monitor is being really wonky right now. So the way you do this, I like to give all of our friends that are sedated or under anesthesia a little pampering. So you'll take their paws and kind of just push their nail out just a little bit. And cats, it's a lot nicer because their nails are typically clear or white like that. And then you can see they're quick actually. So what you're going to do is you're going to take your clippers at about a 45-degree angle and stop just before that quick and cut. And so on and so forth. That typically can be right about where the nail hooks. And again, careful to avoid the quick. And that is how you do a feline nail trim. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to express anal sacs on a dog for fall veterinary nursing care semester 2024. So you'll need gloves, some baby wipes, lubricant, and then your waterless shampoo. You're gonna wanna get a decent amount on your index finger. So with your dominant hand, you'll insert this into the rectum, but you'll lift with your non-dominant hand the tail. The anal sacs are located, if you were thinking about a clock, at 5 and 7, so right about there. And typically they're gonna, for a dog this size, they would kind of feel like the tip of your thumb in size, or like a grape. So I'm going to insert up to the first knuckle, and with a milking motion, I'm going to express his anal sacs. The left one's pretty empty. And his right one's pretty empty as well. So yeah, very small debris. The material in thickness, normal material coming out, should be, I mean, dark in color, but like corn oil. Otherwise, if we're thick, if we have tinges of blood, hard to express, or sometimes there's a thickness of chunks in that, we want to notify the doctor and let them know, because there could be another underlying problem starting. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to apply topical medication for veterinary nursing care fall semester 2024. Miller recently had a visit to the dermatologist, and they had an incidental finding of a skin infection on his lower lip fold here. So we have been instructed to clean with some dilute Chlorhex and apply Animax ointment to that twice a day until healed, and then just as needed. So the first thing I'm going to do, is I'm just going to take this and lift up his upper lip out of the way and clean and scrub that sensitive area of that lower lip. There's one. It's a very hard area, being that there's a lot of high traffic with his mouth in regards to eating and drinking. So trying to get him to not lick it off can be a bit of a challenge, but we do what we can. And I just want to make sure that when I clean it, that the last pass that I have doesn't have a whole lot of debris on it. So not a whole lot on there. I've got my gloves on for this. There are some medications that will require you to wear gloves that are topical when applying them. Zorbium can be one of them, so I just get in the habit of always wearing gloves when applying topical meds. And I'm gonna apply a very small amount to my finger here, less than pea size. And I'm just gonna rub that in really well so that it gets between the hair there, because we want it to work and penetrate to get to the skin. And do a little bit more. I did forget to take into consideration the hair in that area, so. Good boy. Now I do have a cat at home. She is on topical flea and tick prevention. When I'm applying that, I do make sure to be extra cautious, especially when applying topical meds to cats, where it goes. So I go really high up on the base of the head, since cats are able to be really flexible. I don't want them licking that off, or the Zorbium. So I tend to go really high up behind that occipital bone there, and parting the hair to make sure that medication directly contacts the skin and not the hair. If the hair is in the way, it's going to leave an oily residue. It's not going to be well absorbed. It's going to have lower efficacy because it's not really getting to the skin. It needs the skin to absorb and get into the system properly. So that's how you would apply topical meds of various sorts to animals.